welcome to this episode of The Doctor Is In. My name is Corey Burnell, and I have the honor of hosting another episode here with Dr. Randall Smart. Dr. Smart, thank you very much for putting on another show of The Doctor Is In.
Thanks, Corey. It's great to be here today.
Yeah, every time that we do a show, you bring an interesting topic to the table that our viewers can learn something from and hopefully better their lives with the knowledge that you provide. So this episode, we're going to be talking about stress. And
stress.
Yeah.
Right.
It happens to some of us sometimes, I hear.
Can anybody identify with that?
So, interesting topic, certainly covered in literature tremendously, right? It's something people think about, they experience, they wonder how they ought to deal with it. Tell us a little bit about kind of some of the causes of stress and what people maybe ought to be on the lookout for that could raise their stress levels.
Sure, Corey. So, stress, everybody has some stress. It would be absolutely remarkable if there was anybody out there that didn't have stress. And so fundamentally, what is stress? And stress is when your brain perceives a new challenge and it needs to prepare you to meet that challenge. And so there's a little ball of tissue way deep in your brain called the hypothalamus. And that ball of tissue, when it perceives a new challenge, alerts your body to be ready for that. When it does that, your body starts making chemicals and hormones in preparation to meet the challenge. And it's kind of that fight or flight thing. Mm-hmm. And so there maybe is an animal that's being aggressive, or maybe another person, but your brain perceives that, so it sends the signal to produce more adrenaline and more steroid. Your body makes a steroid called cortisone, and so when your brain sends those signals, suddenly you have more adrenaline, you have more steroid. You start breathing faster, you produce more blood sugar, your heartbeat starts beating faster, you get a little bit sweaty, your muscles tense up a little bit, and you're ready to go. Now, if that is a real threat, then that's exactly what you need to do.
Okay.
But if it's something not quite like that, then that can be detrimental. So most people have stress on and off through their life because of these perceived challenges. Like maybe you have a sick child and that causes stress, or maybe a car swerved in the road and that causes stress. Everybody's kind of felt that rush you get, and that's when the adrenaline and the cortisone kick in, and that's short-term stress. It's a normal reaction, and you could see how there could be a genetic predisposition for survival.
Certainly.
So people that are able to do that probably live longer. But there is a line that can be crossed, and that is when stress becomes long-term stress. So short-term stress may be about hours, minutes, hours, maybe a day. Long-term stress is more about weeks or months, where you're continuing to have these reactions, and that's causing new problems for you.
Well, let me ask you a question on that, the difference there between, say, a short-term stress that might be minutes or hours, something that we have in a day, compared to that long-term stress. Where my mind goes with that is that, okay, if I've got a daily stress today, it may be, like you say, I almost was in a car accident, for example.
Sure.
Or perhaps maybe a deadline at work today. Okay, so I've got a heightened stress level, I've got to accomplish this today. And then a longer term stress might be something maybe that's going on in our life that we worry about. Would that be an accurate description?
I think that's fair.
Okay.
Yeah, I think that's fair.
Okay.
Worry and stress are very interlinked. They're really, in a way, they're the same thing. Mm-hmm. Maybe two different words mean the same thing. But that would be accurate. Something, and actually, the mental health professionals have defined things in terms of what is the most stressful for people, and it's a very interesting list to look at. The most stressful thing for us is loss of a loved one. So the death of a spouse, a child, a cousin, a companion, is known to be the most stressful thing. But it's kind of interesting, some of the things on that list you wouldn't necessarily associate with worry and stress, like moving. And moving is actually number 3 on that list.
Really?
And yes, so if you relocate, you get a new job, or there's some new event in your life, and let's say you move to Southern California, or you move to Idaho, or whatever, very stressful. Even if it's all planned, even if the family's okay, even if there's, financial comfort in the whole thing, it's one of the more stressful things we do in life, and people move quite a bit.
It would seem to me, on that subject, now, going back to my college days, I used to move furniture for United Van Lines during the summer.
Really?
So
Wow.
I experienced this with families who are going through this process of moving, One ingredient that would come with something like that is a certain level of uncertainty. Maybe an amount of uncertainty about, well, there's a lot of changes going on. Is uncertainty in one's life something that will contribute to stress levels?
I think you hit on it when you said change.
Okay, change.
And change is stressful. So whether it's a change in a job, or a change in the house, a change in your personal health, when those kinds of events happen, that's more stressful for people. And I can tell you this, I'm digressing a little bit, but it's October 2020, right? Almost November. And I think, as a medical professional, I would have to say I have seen more stress in my patients this year than I've ever seen. Absolute, hands down, not even close. And as you know, we're in the middle of a pandemic.
Sure.
How much change is that?
Right.
Suddenly you're working from home, suddenly the kids are home, suddenly you're maybe not so financially comfortable. But we're in the middle of the pandemic. We're in the middle of an election year where things are really polarized, and I wouldn't describe it as a calm election. And then the state of California is on fire, and Calaveras County is a high-risk fire zone. So all of those things, I think, are on people's minds and more. And I honestly think we've seen more stress this year than I've ever seen. 35 years of medicine.
Yeah, you're right. I guess I can speak anecdotally. I've heard lots of people say, "Man, 2020 is some kind of a year. We just really haven't seen a year like this before," right? You hit on something earlier though about, kind of real world events that cause stress, like for example that work deadline, or the almost getting in a car accident type of thing, versus maybe perceived stresses where, okay, maybe we're worrying about something that may or may not actually be a problem in our life, right? So how have you seen clients patients where you're thinking, well, they're kind of, do we bring the stress on ourselves, I guess is what I'm getting at sometimes.
To me that is such a fundamental question. I don't actually know the answer to this. I could speculate. But I think when you are in a more stressful time, like 2020, I think you start worrying more about other things you may not need to worry about. Because you're worrying about a lot of real things, you're worrying, and you worry, and you worry, and then you say, well, this table could fall over. I think I'll worry about that for a while. Or, there could be an earthquake. We could have an earthquake. I think I'll worry about that. And So I really believe that when people are worried about really tangible things that are normal to worry about, I think their imagination kicks in and they start worrying about a lot of things they don't need to worry about.
We can let our minds run at times. Huh?
Yes, yeah, your mind is very powerful.
Sure, yeah. I think of parents, for example, and I'm a parent of 3. I mean, we worry about our children, and we're susceptible
That's
to letting
stressful.
yeah, it's very stressful, and
Right.
we can let our minds run about what they're doing or what may befall them if they don't do certain things. Yeah. So,
But let's talk about how you might feel if you have that stress.
okay.
So part of the I think confusion or challenge for patients is stress has a lot of physical manifestations. It affects your body in lots of different ways. And so people will say, well, I'm having heartburn because I have a stomach problem. And that may not be exactly right. They may be having heartburn because of the stress and the reaction to stress. And there are a lot of physical things that are like that. And so just to go through a quick list, one of the most common is headaches. So we see people commonly with what we call bitemporal headaches. And gosh, 9 times out of 10, those are stress headaches. Very common. We see people that have dizziness, blurred vision, often related to stress. We see people that have neck spasms and kind of, my neck hurts and I can't get it right and I can't sleep, and often related to stress. We see people with chest pains, and chest pain should never be minimized or solely attributed to stress, but there's a lot of chest pain that is stress related.
Interesting.
We see people that have trouble breathing, and that can be related to stress. We see people with tremors and shakes, stress.
Okay.
People with upset stomachs, that are either nauseous or even vomiting, stress related. And not every one of these symptoms is purely stress. I mean, there are certainly many other things that can do that.
Okay.
But these are common manifestations of stress. One of the biggest ones I see, and I'll say this publicly, is diarrhea.
Wow.
And your gut is very sensitive. And a lot of people, when they get stressed, they go. Usually we see that as a kind of an irritable bowel syndrome,
Okay.
kind of an IBS, where they wake up in the morning, they realize the world's kind of a crazy place, and then they go 3 or 4 times and then things settle down. And definitely a component of stress related to that. So there's lots of physical manifestations. And the way the medical community encounters stress is usually not because somebody comes in and says, hey, doc, I have stress. They come in and say, hey, doc, my stomach's upset.
Sure, they explain the symptom. Or
Yeah,
describe
or,
a symptom,
I've got
right?
these headaches,
Yeah.
do I have a brain tumor? Or, I'm overeating. I'm eating all the time. All I ever do is eat. And I'm gaining weight.
Yeah.
And many of those cases, Corey, are stress related.
Now, I mean, you mentioned the hormonal releases of adrenaline and was it cortisone, you said?
Cortisone, sure.
Yeah. Cortisone's a painkiller, is it? Or
Cortisone
it's
is a
calmer?
steroid.
It's a steroid that your
And-
body will release?
And
Why would the body release cortisone during stress?
cortisone is a hormone that prepares you to
Okay.
survive.
Okay.
And so cortisone will make your blood sugar go up,
Okay.
and you need blood sugar. If you're going to duke it out, got to have some blood sugar, right? Cortisone will make your blood pressure higher. If you're going into battle, higher blood pressure is better. And so cortisone has all these short-term effects that prepare you for that perceived danger.
Well, those sound like things that adrenaline does for you too. So are these two on the same side of the table? Are they? They're
Yes.
creating this. Okay.
Yeah, they kind of act at different receptors, different tissues,
Okay.
but absolutely they both have the same similar effects on your body, and they both prepare you to
Fight or flight.
yeah, let's get in there and win this thing.
Okay. Now, I can see how those would have physical manifestations in the short term, causing your blood pressure to go up, sweaty palms. Long run, is it that as we're stressed, we continue to have heightened levels of these each day that we're stressed, and so does that essentially physically wear us out?
That's a
over time?
bad thing.
Okay.
That is a bad. So it really, as you say, daily you have a little more adrenaline, you have a little more cortisol, and so one way to think of it is kind of a chronic state of inflammation. You know, you're in a chronic state of inflammation, so blood sugar goes up, that's diabetes. Blood pressure goes up, that's hypertension, cardiovascular disease, strokes. There's some very good correlations with stress and heart disease. I think most people understand that. But exactly, that those, that creates this chronic problem. You know, if you had that happen to you for an hour or so, it'd be great. Mm-hmm. You would do well in whatever you were encountering. But if that goes on day after day after day, you're exactly right. It's counterproductive. It creates a number of other problems, and can ultimately create a lot of morbidity.
Mm-hmm. Well, how about ancillary impacts? Like, for example, if I've got things I've got to do the next day that have me stressed out tonight, I may have trouble getting to sleep, and I may only get 4 or 5 or 6 hours of sleep rather than 6, 7, or 8, right? So now I'm exhausted the next day, or I'm amped up on adrenaline and cortisol because I'm stressed.
Yes,
so maybe
you are.
I'm not exhausted, but I certainly didn't get the sleep I should have gotten. So the long-term impact of these ancillary problems that we have that they go along with, maybe you're not getting sleep, or maybe because you're stressed you're not eating in a healthy fashion or manner. Can you speak to that, these other things that it causes maybe in a person's life?
Yeah, you hit it exactly, Corey. Is people under stress typically don't sleep very well. Mm-hmm. They're worried or concerned, and sometimes that's appropriate. You know, maybe there is a fire nearby, or maybe they need to listen for the sound of a sick child. But if it's chronic and it's day after day, that loss of sleep is really detrimental to your health. Mm-hmm. And one of the things people do is they resort to something that calms them down. You know, I think they feel a certain sense of stress and tension, and so one of the things they do is they turn to alcohol.
Sure, medicate. Right?
Yeah, I guess you could call alcohol medicating.
In a fashion.
But for many people, having that one drink is calming. Mm-hmm. I mean, it just, it just feels good. Not as, and I kind of like it. I think I'll do it tomorrow night. And I think I'll do it over the weekend. And, just going home every night and having a drink is a good idea. Maybe I'll make it 2, because that feels really good. And, pretty soon you have somebody that is, practicing unhealthy behaviors, alcoholism or just too much alcohol. But we kind of turn to things that are, we think will calm us, but they're not exactly healthy behaviors.
Well, yeah, I guess when I use the term medicate, where you medicate a symptom rather than deal with the cause of the
right.
problem.
You're probably hiding the symptom.
Yeah.
Right. Yeah, exactly.
Well, let's talk a little bit then about underlying solutions, or solutions to the underlying problem would be a better way of communicating or
right.
expressing.
So what do you do?
Yeah.
Yeah. So probably the most important thing, and the message I'd really like to communicate today, is to take a step back and say, am I under stress? Is the reason my back hurts more, is because I'm under stress? Or are these headaches caused by stress? Or is my insomnia, my lack of sleep, or maybe my weight gain caused by stress? And so the first thing is self-recognition. You know, am I stressed, and what may be the cause of that? Is it because we're moving? Is it because things at work aren't good? Is it because these kids are home all the time? You know, and I think the first thing really, Corey, is self-recognition, to say, you know, I think I'm stressed.
I guess you have to diagnose, right?
Well, right.
You need to diagnose the problem.
You have to, you know, have a certain amount of insight on who you are and why you're having the problems you are. And probably not dismiss, you know, behavioral health issues, anxiety, stress, depression, which can be accompanied by stress, to not just dismiss those and say, hey man, I'm rock solid. I hear this all the time. Man, rock solid. Everything's great. I just can never sleep and I'm drinking a lot. So, you're not exactly rock solid. And once you start talking to those patients, they go, you know, yeah, the job is not so easy, or I got a pay cut, or, you know, I've been having a knee pain thing and I feel like I'm getting older. And so if people self-recognize, then I think that's really key. And then at that point, there are things you can do. Or you can go to the doctor. You can come and see me or your regular primary care doctor and say, hey, you know, I think my headaches are maybe stress. Can we talk about that a little bit? And that's perfectly fine. That's encouraged. But then there are things you can do, and things you probably shouldn't do. We know that watching television and playing video games makes stress worse. Sitting down and doing absolutely nothing makes stress worse. And 2020 has been all about sitting around and doing absolutely nothing. So that's not a big surprise, but it's not healthy. Particularly the television and the video games, or just stuck on that iPhone all day long. Not a good idea. So physical activity really helps.
Okay.
You know, whether it's walking, whether it's getting outside. I mean, you don't have to be a marathon runner, but you need to move. You gotta move.
Let me ask you about that. You know, with the physical activity, I'd imagine it's probably a combination of two things, but I'm asking here. Obviously, you have the mental distraction of going and doing a physical activity rather than maybe having your mind on a stressful situation like a video game or the evening news, something like that.
That's a bad thing.
Right, yeah.
Right. And I don't even care what channel it is.
Right.
It's a really bad thing.
If you're watching the news, you're probably stressed.
Get away, right.
Then the other thing being is the chemistry of the physical exertion. I've heard that there are endorphins released during physical exercise. So can you speak to how that impacts physical response to stress?
Well, right. So what we understand is these activating hormones and chemicals like adrenaline, cortisone. When you start moving around, those get used up.
Oh, okay.
You know, so you don't have as much of that in your system. So they get used up, and your hypothalamus and your brain calms down and says, okay, they did whatever the problem was, and now your brain perceives it as you've met the challenge.
Yeah, things are safe again.
Yes, exactly. Okay. Yeah, so you just literally burn up some of these things that are making you stressful. But I think you're right. I think you do produce some endorphins. You do burn off some sugar that's created. You do lower your blood pressure. You now have a reason for your pulse to be a little bit faster, and so it's basically kind of burning up the stuff that's, you know, running around in your system and making you tense.
Okay. Yeah,
exactly. And there are other things. Less alcohol is a really good idea. This is probably one of the few programs where tobacco is probably not a bad idea. Tobacco is very calming. Now, tobacco is not a good idea. We all know that. It causes lung cancer.
Sure.
But I don't know, did you ever smoke?
No, I've chewed at times, and I smoke an occasional cigar.
Yeah, I smoked when I was younger, and
Yeah.
it has this very calming effect. I mean, the nicotine just has this very, very calming effect.
Yeah.
But then, to maybe...
So could somebody take a nicotine patch, for example? Would that be an unhealthy way if they were trying to calm themselves?
That would be
other-
called an experiment.
Oh, okay.
With one
Well, we're
exception.
brainstorming here, Dr.
Right,
Smart.
right. With one exception is if you had quit smoking
Okay.
and you were having anxiety and it seemed related, then the nicotine patch is a great idea.
Okay.
But let's say it's you or me, not smoking, we're having some anxiety,
It doesn't make much
slap
sense.
on a nicotine patch. I don't know.
Yeah.
I think that would be an experiment.
Okay.
But relaxation helps. Muscle tension exercises help. Meditation helps. Tai Chi helps. And the healthcare district has a number of Tai Chi classes in the county. They're online classes right now because of the pandemic.
These are things that essentially calm your mind, get your mind centered.
Correct.
Okay.
Yes.
All right.
Yeah,
So to get
yes.
back to that subject of worry, for example, it may get
Mm-hmm.
you off of something you're worrying about.
And then, of course, there's medications.
Yeah.
I mean, we have medications.
We only have a couple minutes left, but let's talk about, just very briefly for about a minute here, medication versus trying to get at the underlying cause of the stress and dealing with it in a healthy manner rather than medicating the symptom. What are your thoughts there?
Well, I am a naturalist.
Okay.
I believe your body is a great thing, and if you take care of it, it'll take care of you. Now, there are exceptions, many, but I don't. What I don't like is for every problem there's a bottle of pills.
Sure.
I just don't like that. I don't practice that way. I talk to people about their problems. We have therapists in our clinic, and we use them a lot to talk people through their anxiety or depression. So I don't think a bottle of pills is an answer for every problem. I just don't, Corey. I think that's not good medical care.
Sure. So the solution, talk with your doctor, find perhaps maybe even a better solution than medication, but it's available if it absolutely needs to be used. Is that
Perfect. Yeah, perfectly said.
Well, Dr. Smart, I think we could have done an hour on this topic. I'm stressed out that we only had 30 minutes. But to our viewers, thank you very much for joining us on this episode of The Doctor Is In. And Dr. Smart, fantastic info as always. I know everybody is leaving watching this program better informed and ready to tackle life tomorrow. So thank you again, Dr. Smart.
Laughing helps.
There you go.
Laughing helps.
All right, folks, we'll see you next time on The Doctor Is In.